This is a SLAP repair post-operative protocol. The goals and expectations following surgery are that the shoulder will become stiff following the surgery. Allowing the shoulder to stiffen facilitates healing of the repair. It is expected and it will resolve with the help of physical therapy. On the day of surgery, you want to use ice or cold therapy over the shoulder for 15 minutes every 1 to 2 hours. Begin taking pain medication as prescribed as soon as you have pain. Do not wait until you are in severe pain before taking them. You should be able to stop taking the pain medication within 2 to 3 weeks. Begin eating with liquids and light foods. Progress to your normal diet slowly over the first 24 hours. Keep the dressings on the surgical site until your first post-operative visit. Usually this is 7 to 10 days after surgery. You may bathe or shower after surgery, but keep the dressings completely dry and the bandages on. No swimming until instructed by your surgeon. Continue to use the sling until your first post-operative visit. You will continue to wear the sling for 6 weeks following surgery to allow time for the shoulder to heal. Do not drive until instructed to do so. You will begin formal physical therapy at 7 to 10 days following surgery. We will give you a list of physical therapy facilities as well as a prescription prior to surgery so that you may schedule in advance. It is normal to experience some swelling and bruising in the arm, elbow, and wrist. You may bend the elbow and wrist, and this will decrease the amount of swelling you have in the arm. It is very helpful to keep the arm elevated on 2 to 3 pillows so that the arm is above the level of the heart while lying down. There are 4 main phases of rehabilitation after the early postoperative phase. In the early postoperative phase, from 0 to 2 weeks, the goal is to control pain and swelling and to begin a passive motion program. Exercises and activities allowed will be straightening and bending the elbow, wrist, and fingers several times a day, shoulder shrugs, squeezing the scapula, ball squeezes, and passive range of motion of the shoulder. Avoid actively elevating the arm and avoid lifting objects in the arm. Shoulder shrugs are demonstrated by this picture where you shrug your shoulders as far up as they can go and hold them for 5 to 10 seconds. Lower your shoulders down and then repeat this 10 times. Scapula squeezes involve flexing the muscle between your shoulder blades to try and pull your shoulder blades together in the back. Hold this for 5 to 10 seconds and repeat it 10 times. Ball squeezes are self-explanatory. Elbow range of motion involves straightening and bending your elbow as far as you can tolerate. It also involves supinating and pronating, which means turning your palm up and then down. Do this 10 times to work on elbow motion and hand and wrist rotation. Shoulder range of motion involves gently using your non-operative arm to lift your surgical arm 90 degrees to the level of your shoulder. This is considered passive motion when you or someone else lifts the arm, not active. Physical therapy will limit your range of motion to passive forward flexion of 120 degrees and passive external rotation to 30 degrees. In phase 1 from 2 to 6 weeks, the goals are healing of the repair and restoring passive range of motion. You must wear the sling at all times except when bathing, even to sleep. Passive range of motion is limited to forward flexion to 120, external rotation to 30 degrees. Avoid actively elevating the arm and avoid lifting objects with the arm. In the second phase from week 6 to 12, full range of motion is the goal as well as beginning a cuff strengthening program. Discontinue the sling at week 6 and proceed with various physical therapy modalities, passive and active range of motion, biceps and triceps strengthening, scapula stabilization, rotator cuff program when range of motion is achieved, pulleys, pull therapy, and a home program. In the third phase, the goal is full range of motion and strength to 90% compared to the other side. All of the same exercises and activities are done to achieve this. In phase 4, greater than 18 weeks, the goal is to return to sports.